The Manitoba Nurses Union is warning that nurses are at a breaking point. And to that, we've invited to the program today Darlene Jackson. She is the president of the Manitoba Nurses Union, and she joins us right now. Darlene, thank you for speaking with us today.
Thank you for inviting me.
So we just heard from the Premier. He wants vaccines to cross the border from the United States into Canada. That is something that we're tracking. But, you know, this comes after he turned to Ottawa just this week asking for help from the Trudeau government, requesting 50 critical care nurses and 20 respiratory therapists for Manitoba as it deals with this third wave. Is that enough, do you think?
I don't believe it is. We are in a critical nursing shortage. Our ICUs are full, our COVID units are full, and our emergency departments are backing up with patients who are on ventilators or requiring a bed in a COVID unit. And I don't believe that 50 critical care nurses is going to make that big of a difference. And this is an issue that's been growing over the past 5 years. We've been bringing attention to the fact that our nursing shortage is getting bigger and bigger every day, and this government has basically ignored those pleas for help.
I'm going to pick up on that point, but I do want to stay here rather as you're talking about the conditions that nurses are dealing with right now. What are you hearing from them about the type of strain, the kind of stress that they're feeling right now, not only physically and with their time, but also how this actually affects their mental health?
Well, what I'm hearing from nurses in this province is they are exhausted. They have really had no opportunity to rest and rejuvenate over the past year. We have nurses that are working double shifts. I've heard of nurses working triple shifts. We have nurses that are been mandated to work overtime. When you go to work, you do not know if you're going to be able to go home at the end of your shift. So we have nurses that are exhausted and that are incredibly concerned about the care that they can provide to their patients. Our intensive care units are full. We're expanding beds, and pushing a ventilator beside a hospital bed without a nurse beside it, you've just opened a bed. It's not really a hospital bed if there isn't a nurse beside it.
Well, it's interesting you say that because as you say that, we've also heard from the government and they say that nurses right now are being moved around to accommodate staffing shortages. What do you say to that?
Well, we have a finite number of nurses in this province. The pool is what the pool is. So to be perfectly frank, picking up nurses and moving them out throughout the system to cover the hot spots, all it does is rob Peter to pay Paul. It puts a Band-Aid on the biggest problem, but it doesn't solve the basic problem, which is we do not have enough nurses to staff this system.